Hey everyone, and welcome back to the channel. Today we're diving into a topic that many people have questions about but might find it a bit tricky to talk about: erectile dysfunction, or ED. Specifically, we're going to discuss a treatment option called Trimix. If you or someone you know is exploring ways to manage ED, this video is for you. We'll break down what Trimix is, how it works, what to expect, and its potential side effects. Remember, this video is for informational purposes only and isn't a substitute for professional medical advice. Always talk to your doctor to figure out the best treatment plan for your specific situation. So, what exactly is Trimix? The name Trimix literally means a mix of 3 ingredients. It's a compounded medication, which means it's custom made by a pharmacy. The 3 active ingredients are alprostadil, phentolamine, and papaverine. Each of these components plays a crucial role in helping to achieve an erection. Trimix is administered as a self-injection directly into a specific part of the penis. Now, I know what you might be thinking, an injection there? It sounds a bit intimidating, but for many men who haven't had success with other treatments like oral pills, Trimix can be a very effective solution. Let's break down how these 3 ingredients work together. First up is alprostadil. Next, we have phentolamine. Phentolamine belongs to a class of drugs called alpha blockers. Its role is to block certain signals from the nervous system that cause blood vessels to constrict or tighten. In simple terms, while alprostadil is actively opening up the blood vessels, phentolamine is working in the background to prevent them from closing back up. It is like a traffic controller, making sure the highway stays open and traffic flows smoothly without any roadblocks. This cooperative action helps to sustain the increased blood flow needed for a firm and lasting erection. The third component is papaverine. Papaverine is what's known as a vasodilator, similar to alprostadil. It also works by relaxing the smooth muscle tissue in the arteries of the penis. This relaxation allows more blood to enter. But papaverine has another important function. It helps to trap the blood inside the penis by compressing the veins that would normally drain the blood away. So not only does it help more blood get in, but it also helps keep it there. When you combine papaverine with alprostadil and phentolamine, you get a powerful synergistic effect. The 3 drugs work together from different angles to create a strong and reliable erection. Now, let's talk about who might be a good candidate for Trimix. Typically, Trimix is considered when other less invasive treatments for ED haven't worked. This often includes oral medications like sildenafil, you might know it by its brand name, Viagra, or tadalafil, also known as Cialis. For some men, these pills are either not effective enough or they cause undesirable side effects. Others might have underlying health conditions, like severe heart disease or diabetes, that make oral ED meds a risky choice. Men who have had prostate surgery can also experience nerve damage that makes oral medications less effective, and for them, Trimix can be a game changer. It's really a solution for those seeking a highly effective and reliable treatment when other options have fallen short. A thorough consultation with a healthcare provider, usually a urologist, is essential to determine if Trimix is the right and safe choice for you. So, how is Trimix administered? This is probably the part that makes most people a little nervous, but with proper training, it becomes a very straightforward process. The medication comes in a small vial, and you'll use a very fine, short needle, similar to what's used for insulin injections. Your doctor or a nurse will give you detailed in-person training on how to do this safely. They'll show you exactly where to inject on the side of the penis, avoiding the top, bottom, and the head to miss any nerves or the urethra. The area is cleaned with an alcohol swab, and the injection itself is quick. Many men report that it's surprisingly painless, often describing it as a small pinch or a slight pressure because that area of the penis has fewer nerve endings than you might think. After the injection, you apply gentle pressure to the site for a minute or 2 to prevent bruising. The onset of the erection is usually quite fast, typically within 5 to 20 minutes. What can you expect in terms of results? One of the biggest advantages of Trimix is its high success rate. Studies and clinical experience show that it's effective for a very large percentage of men who use it, often over 90%. Unlike oral medications that may require sexual stimulation to work, Trimix often induces an erection automatically as the medication takes effect. The erection produced is typically very firm and can last for the duration of sexual activity, usually around 1 to 2 hours. The dosage of Trimix is carefully customized for each individual. Your doctor will start you on a very low dose and gradually adjust it to find the minimum amount needed to produce a satisfactory erection that does not last too long. The goal is to have an erection that is functional for intercourse but resolves naturally afterward. Of course, like any medication, Trimix comes with potential side effects and risks. The most common side effects are usually localized and mild. You might experience some minor pain, aching, or a burning sensation at the injection site. A little bit of bruising or swelling can also occur. Some men might feel a bit dizzy or lightheaded, but this is less common. The most serious potential side effect, though rare, is priapism. Priapism is a prolonged erection that lasts for more than 4 hours and is a medical emergency. It happens when blood gets trapped in the penis and can't drain out. If left untreated, it can cause serious damage to the tissue. This is why the initial dose titration with your doctor is so important, to find a dose that is effective but does not carry a high risk of priapism. Your doctor will give you clear instructions on what to do if an erection lasts too long. This usually involves having a specific antidote medication at home or knowing when to go to the emergency room. Another, much rarer risk is the development of fibrosis, which is the formation of scar tissue inside the penis. This can sometimes cause curvature or lumps. To minimize this risk, it's crucial to rotate the injection site with each use, alternating between the left and right sides in different spots along the shaft. So how do you get started with Trimix? The first step is always to have an open conversation with your doctor. They will review your medical history, perform a physical exam, and discuss all your treatment options. If you both decide that Trimix is a good path to explore, you'll receive a prescription. Since Trimix is a compounded medication, it will be prepared for you by a specialized compounding pharmacy. It needs to be stored properly, usually in the refrigerator, to maintain its potency. The pharmacy will provide you with the medication, sterile syringes, alcohol swabs, and a sharps container for safe disposal of the used needles. Remember, the training session with your healthcare provider is not optional. It's absolutely essential for learning the correct injection technique and understanding all the safety protocols. They are there to support you and make sure you feel confident and comfortable with the process. In summary, Trimix is a highly effective, safe, and reliable treatment for erectile dysfunction, especially for men who haven't had success with oral medications. It's a powerful combination of 3 drugs, alprostadil, phentolamine, and papaverine, that work together to increase blood flow to the penis, resulting in a firm and predictable erection. While the idea of self-injection might seem daunting at first, most men find it to be a simple and manageable routine with proper training. The key is working closely with your healthcare provider to ensure it's the right choice for you, to find the correct dosage, and to learn how to use it safely to minimize any risks. Communication is everything. Don't be afraid to ask your doctor questions and to express any concerns you might have. Managing ED is about finding what works best for your body and your lifestyle, and for many, Trimix has been an incredibly positive and life-changing solution. Thank you so much for watching. I hope this overview has been helpful and has demystified the topic of Trimix injections. If you found this video informative, please give it a thumbs up and consider subscribing to the channel for more content like this. And as always, remember to take care of yourselves and to seek professional medical advice for your health concerns. We'll see you in the next video.